When doing the Braden scale for pressure ulcer risk, you want to make sure you do a risk assessment and you want to check their sensory perception. So there are different categories on the Braden scale, which is sensory perception, moisture, activity, mobility, nutrition, friction, and shear. And each category you can rate from a 1 to a 4, except for friction, which is 1 to 3. So when you do sensory and perception, you want to make sure that you're checking your patient's cognitive function. You want to see if they're completely limited. Are they responsive to verbal stimuli or painful stimuli? Can they communicate that, or if there's no impairment at all? So with the scale, the lower the score, the higher you are for risk. So from being completely limited at 1 to having no impairment at all would be 4. The other category for Braden scale would be moisture. So you want to check to see if the patient is incontinent or continent, because you know when they're incontinent, they're more frequent to urinate, and moisture is a risk factor for pressure ulcers. You want to monitor. The next category would be activity. So you want to see how active is your patient. You want to know if they're bed fast, if they're chair fast. Do they walk occasionally or do they walk frequently, which would be number 4. You also want to test their mobility to see if they're completely immobile, if they're very limited, slightly limited. Is there no limitations at all? Are they able to do things on their own? Do they need assist? If they're not really mobile, you know they're more at risk to gain pressure ulcers. You also want to check their nutrition. Do they have a diet that is poor or a good diet? Because you know if they have a diet that may be low in protein, that means that when they do get a pressure ulcer, is it going to be difficult to heal? Is it going to be a smooth healing process, or is it going to be more difficult? The last category would be friction and shear, which has to do with positioning. So if a patient needs to be positioned, the friction and shear from the movement can affect them and cause them to have pressure ulcers, usually on the sacrum, the ears, on their heels. So you would rate each category on a scale of 1 to 4. 1 meaning that they are completely limited, they're bed fast, they're constantly moist, completely immobile, or their diet is very poor. 4 meaning that there's no impairment, they're rarely moist, they walk frequently, there's no limitations, and their nutrition is excellent. You also wouldn't just depend on the Braden scale, but you would also use HALT measures, which checks if they have a history of pressure ulcers before, if they have any comorbidities, poor diet, or medications that they're taking that may affect pressure ulcer and healing process. You want to look and inspect the skin, and you also want to touch the skin. And that's it.